My story begins back in 2004 when I was 18 years old. And at the time I was studying history at a university in England, in the city called Sheffield. And Sheffield's not quite Madrid or Milan. It's quite famous for two things. One, for producing lots of steel in the past. And secondly, for producing probably the most successful British film of all time, where some of those steel workers lost their jobs and began to take their clothes off for a living, called the Full Monty, and I'd recommend it if you've not seen it. My time at university began so well. I was making so many new friends and literally having the time of my life. And I thought that I was invincible, which quickly changed when I was diagnosed with Hodgkin's lymphoma on the 26th of February 2004. And I'm pictured there with my mother at a funeral just after diagnosis. 6 treatments of ABVD chemotherapy followed, and I was treated at an adult hospital in a town in the middle of England near where my parents lived. The only late effect that was mentioned to me at the time of diagnosis was that chemotherapy could affect my fertility. Although I was only 18 and hadn't thought about having children yet, one of the most shocking things on the day of diagnosis was that treatment had the potential to affect my ability to become a father. And I'm pictured there with my father at the time. However, I'm so glad this was mentioned to me at the time, as it meant I could preserve samples of sperm. After chemotherapy, I had a CT scan, and luckily it stated there were no further signs of cancer. However, I then went on to receive radiotherapy once a day for 4 weeks, and was told this was to maximize the chances of the cancer not recurring. I can still vividly remember the last day of treatment. There wasn't a sense of jubilation or joy. It was a relief to finish treatment, but I spent most of that day arguing with my poor mother. I think we were both so emotional after the events of the past few months. So, after radiotherapy, what then? Was it back to normality, back to having a good time and wearing a tutu? Well, actually, it wasn't as simple as that. I was able to continue at university, but I actually began to find life much more difficult after treatment had finished. I can look back and see I always had a predisposition to feeling anxious, and my illness brought it out of me after treatment had finished. Suddenly, there were less appointments with my doctor. I now only saw him every 3 months. Who did I look to for reassurance? I still had many questions to ask, and I still felt out of control. I could never have gone back to feeling how I did before treatment, and in fact, nothing would be the same again. With hindsight, I can see I had all the classic symptoms of depression and anxiety. I woke up early each morning, my mood varied during the day, and I lost interest in socializing, work, and eating. However, I also became incredibly fearful of the cancer returning. I began to start checking my body, often multiple times throughout the day. I'd seek reassurance from family, friends, and those that treated me. But I thought I could actually feel that the lumps were there, and this made me feel as if I was going crazy. This reached a critical point about 18 months after treatment had finished. I went to see my GP, primary care doctor, who gave me the diagnosis of anxiety and depression. He prescribed me antidepressants, and I began cognitive behavior therapy, which helped a great deal. I wish I'd been offered psychological support at a much earlier stage. Unfortunately, none was offered during treatment. However, there was also the fact that I didn't know what depression or anxiety was, and so I didn't know what symptoms to look out for in order to seek help. My mental health has improved a lot since then, although there are still times when I get paranoid about my health and about cancer. And although cancer and my mental health are linked together, for me, dealing with depression and anxiety in survivorship was harder than dealing with the effects of chemotherapy and radiotherapy during cancer. My experience of the doctors and other healthcare professionals that helped me through both cancer and my psychological problems inspired me to want to become involved in the medical field. 2 years after finishing history, I returned to university in Sheffield to begin medicine, and I'm due to graduate this summer. I attended a conference at the end of 2008 in Sheffield and met a nurse consultant there who invited me to join the National Cancer Survivorship Initiative as a user representative. This opened up many doors to me, and I've been proud to represent teenagers and young adults in the UK since then. I actually found this is the front of a booklet, which I found at one conference, and thought someone had written a biography of my life, but it was about a different time. The research I've been involved in has not only allowed me to share my experiences with professionals to help shape the future, but also to share my experiences with other young people to help me further come to terms with what happened to me and help me realize that I'm not alone. For many years, I thought I was virtually unique and that young people simply didn't get cancer. This work allowed me to discover the Teenage Cancer Trust, and I've since been lucky enough to work with them and experience the fantastic support that they offer. This has included helping to organise and speak at their annual patient conference, Find Your Sense of Tumour, where I got to meet hundreds of other young cancer patients, and I'm pictured there at the conference. I think in the future, it will be important to create further networks to allow survivors of teenage and young adult cancer to share experiences and to enable peer-to-peer support for problems that may arise during survivorship. This links in with the feeling that some young people could get as they move out of the protective sphere of age-appropriate care. As I explained earlier, survivorship actually became a very frightening place for me. And this could also apply to young people who've received fantastic age-appropriate care, but then have to transition into generic adult survivorship. I think that's why what Sue and Dan were saying yesterday is so important about that smooth transition and the role of people such as the key worker. I should also mention here the issue of survivorship and loss of friends. Meeting other young people with cancer can be a very therapeutic experience. And even though I was treated as an adult, I've since made close friends with young cancer patients and survivors that I've met. However, naturally, some of these friends will not become survivors, and I, like many young people, have lost friends along the way. This can be incredibly difficult, as a very close relationship can be forged in a short time. Survivorship guilt is not something I have experienced, but I mention this as numerous young people I've spoken with have struggled with this feeling in an attempt to rationalize why they have survived, but others have not. Another benefit to the research I've been involved in has been the discovery of the late effects clinics that are available to some survivors. I was discharged after 5 years of follow-up by my haematologist. I only discovered this service in my city as a result of becoming involved as that user representative, and then I had to get my primary care doctor to refer me, as she hadn't heard of the service. Now, I am 10 years after diagnosis, and pleased to say there has been no evidence of relapse. But one of the most difficult aspects to deal with has been the discovery of the potential long-term implications of the therapy that I received. I was never told that doxorubicin could affect my heart, that bleomycin could harm my lungs, or that vinblastine could cause neuropathy. Fortunately, these potential effects have not materialized, but it is only because I'm in that late effects clinic that I've been able to have echocardiograms, lung function tests, and other investigations to check. More recently, I've been found to have low levels of testosterone. While I didn't think I was symptomatic, it is only through hormone replacement therapy that I've truly realized what I was missing, especially in terms of the boost it has given to my energy and my mood. And I'd certainly recommend testosterone to any of the men in the audience if you can get your hands on it. The endocrinology professor who initiated my therapy was part of a study in 2007 that looked into the prevalence and consequences of androgen deficiency in young male cancer survivors in a controlled cross-sectional study. This found a significant proportion of young male survivors had lower testosterone levels than controls. They also had a greater fat mass, higher fasting insulin and glucose levels, increased fatigue, and reduced sexual function and health-related quality of life. This study has led to the TRIMS trial, testosterone replacement in young male cancer survivors, a randomized, double-blind, placebo-controlled trial that is ongoing. This renewed energy has allowed me to begin to enjoy exercise, and this in turn has done a great deal to aid my recovery, and particularly in further improving my mood. I would have loved to have been given the encouragement and advice on exercise and healthy eating, both during and after treatment, especially now I've seen the positive impact that it can have. Another dilemma facing clinicians in the future will be as other late effects emerge and when standard treatments change. I'm sure we're all aware of female Hodgkin survivors who had mantle radiotherapy and went on to develop breast cancer. Indeed, I was at a conference in Manchester in 2012 when the results of the RAPID trial were announced, which was mentioned during the first talk this morning. This trial looked at the use of PET scanning early-stage Hodgkin's patients after ABVD treatment. Those who were PET negative were randomized to receive involved field radiotherapy or no further treatment. As you can see, the progression-free survival was very similar, and the authors of that study concluded that radiotherapy is unnecessary in the 75% of patients who were PET negative after 3 cycles of ABVD. I asked the professor that day, "What are you going to say to people like me in the future?" This wasn't to make him feel awkward. We both agreed I had the appropriate treatment at the time and that protocols can change. But I think clinicians do need to be prepared for this in the future, especially as late effects emerge in treatments that may subsequently go out of favor. As for the future, one area of my survivorship that still needs to be resolved is my fertility. I've never had semen analysis performed since I had treatment, and this has been due to the fact that I've not been in a position to want to have children yet. This has been my choice, and I've been okay with not knowing. Of course, the testosterone treatment I'm now on could well decrease spermatogenesis in me, and this could well make things even more complicated in the future. A key aspect in my survivorship is being able to have my voice heard. I've been lucky enough to represent teenagers and young adults in the UK for a number of years. I currently sit on the clinical reference group for the NHS, which is helping to commission specialist services in this area. I'm proud that I have an equal membership of all the clinicians that sit on that group, and I think that young people will need to be involved at every stage while thinking about coordinating late effects and survivorship models for the future. On the left there, I'm pictured with a German cancer patient and 2 of the Queen's granddaughters, Princess Beatrice and Princess Eugenie, at an ENCCA-themed event in Hanover, Germany, in January of last year. Finally, I wanted to show you this slide. I was initially inspired by a project that originated in Leeds in England called "What Colour is My Cancer?" This project allowed young people to see firsthand what their cancer looked like under a microscope. So, at one of my appointments, I said to the doctor, "What does my cancer look like?" And these histology slides were actually taken from my neck back in 2004. If you look really closely, You can spot the Reed-Sternberg cells, maybe. I wanted to know everything about my illness when I was ill, and this became my major coping strategy. I'm not saying that all patients need to be encouraged to become health professionals after their illness. For me, though, gaining an insight into my illness allowed me to take some control back, especially after feeling out of control for so long. This is why discovering late effects years down the line has proven so frustrating for me. The increased numbers of young people surviving cancer is a positive reflection on how far treatments have come. However, survivorship does still seem to be a relatively new concept. I think that to meet the needs of survivors, both now and in the future, effective models of care need to be built, and these actually need to begin at diagnosis. Thank you.